Joining us with more is psychologist and early show contributor Dr. Jennifer Hartstein. First, Jen, what's the difference between, we've all heard of bipolar disorder. What is that versus bipolar 2?
Well, bipolar 2 is a milder version of bipolar disorder. So we think of bipolar disorder as the highs and lows, the real mania. Bipolar 2 is characterized much more with more depressive episodes. So that's where it kind of sits. And then there's at least one episode of a hypomanic episode, which is not quite the very high, out of control mania that we might come to expect, but much more elevated mood or rapid speech or thoughts that are kind of all over the place. So it's that mania, but kind of mania light, not really so extreme.
And stress, as we're learning, can really play a big role here. Anybody who has dealt with a loved one going through cancer treatments knows what that stress is like.
Right.
Would you imagine that stress could be a trigger in this case?
Absolutely. Stress in and of itself isn't enough, but it is a trigger. So we don't know what her predisposition was to bipolar illness before. The fact is that has she had any mental health problems? We don't know. Family history of bipolar will increase her likelihood of this being a problem. So the environment can play a role, and then the biological. So the two in combination, the stress is going to exacerbate the symptoms that are already possibly there.
Some of these symptoms can just feel like isolated incidents until you look back and then you start to put them together. 6 million people, I believe, in this country are thought to suffer from some sort of bipolar disorder. So what are the signs? How do you know that's what it is?
Well, it's not the typical highs and lows that we think about. We all have ups and downs during our day or during our week, so we want to really think about a couple things. We first really want to look at the depression versus the hypomania. Are we having those highs and lows that are extreme? Are we having an elevated mood, out of character? Are we not getting enough sleep? So you can really exist on 3 hours of sleep, not because you have to, but because you feel fine and rested. And are you having rapid speech? Those are just some of the symptoms that we want to look for. There are more, but those are some hallmarks.
When it comes to treatment, we've learned from the statement that she reportedly checked herself into a treatment cell, a mental health facility rather, for treatment. What kind of treatments would be involved with this?
The best kind of treatments that they have shown to maintain a positive and healthy lifestyle are psychotherapy, specifically cognitive behavior therapy, to learn new skills to manage those highs and lows, and medication. And the two in combination seem to be the best and most effective way to treat it.
Long term, what are we looking at?
Well, it's a long-term illness like any other long-term illness. So as you continue to treat it using psychotherapy, using medication, you can live a full and healthy and productive life and learn the things that are going to help manage your stress so that when that stress comes, you can really be okay and manage those things.
And ultimately, hopefully this, by her coming forward, maybe it'll help inspire a lot of other people to put those things together and maybe get help if they need it.
Asking for help if you're worried is really the first step.
Yeah, and the hardest one oftentimes too. Jen, thanks.
Thanks.